Good morning. It's a great pleasure to be here to tell you a bit about what we do at Allarta Life Sciences. We are located in Hamilton, Ontario, which is, I think, about 7,000 kilometers in this direction. And it's a pleasure to be here and follow in the footsteps of Vesigen and Splice Bio. So our company looks at encapsulation of therapeutic islets, stem cell-derived, donor-derived islets, for type 1 diabetics. And one of the key focus in our company, at least originally, was on the development of the hydrogels that would enable this transplantation. Allarta's two co-founders are here besides myself. It's Maria Antonakos, who's in the audience as well. She deals with operations and external partnerships, and I would encourage her to seek her out and talk with her as well. My background is as a polymer scientist. I used to lead a large academic group, and I'm now CEO and CSO. We have founded the company a number of years ago, 5 years ago, by translating the academic technology into our spin-off company and evolved the technology further. We have a strong board of directors seen on the left that are equity investors and have very good corporate expertise, corporate governance expertise. And we are guided by a science advisory board that cover all the relevant expertise that we need in the company, from fundamental science all the way to company formation, company building, regulatory, and translation to the clinic, so it includes surgeons and other medical experts. This slide summarizes our approach and our technology. So if you take one thing home, look at this slide carefully. What we're aiming to build are high surface area therapeutic devices that allow transplantation without immune suppression of allogeneic cells. We focus on endocrine disorders, and our lead indication is type 1 diabetes because it's a large unmet need, especially for patients with severe hypoglycemic unawareness. The real magic in that field happens when the cells meet the patients and are enabled to exert their therapeutic function. And those are the green blobs that you see in the middle. These could be donor islets, stem cell-derived islets. The minor magic that we contribute are the wiggly lines on the top left. These are synthetic polymers that we've designed over now 30 years, first in academia and now in the company, to mitigate the relationship between the transplanted cells and the host. T1D is an autoimmune disorder, so in addition to alloimmune rejection, we are also facing the autoimmune rejection, which are about 150 kilodalton autoantibodies that need to be excluded from contact with the transplanted cells. And so we've designed polymeric materials that are the synthetic equivalents of peptides, you might say, that meet the attributes shown on the right-hand side. They are synthetic for definability. They are covalently cross-linked with carbon-carbon bonds for persistence in the body. We want these devices to last up to 5 years and perhaps longer. And you can read the other attributes. They have a high surface area to enable good metabolic exchange between the cells and the host by diffusion. They are retrievable, and they prevent cell escape. The cells, or the devices, are shown at the bottom. We call them life spheres, life lines, and life rafts. They all have in common a common composition and certain other properties that enable those attributes on the right. We have a little video that summarizes these and illustrates how we combine those gel formers with different therapeutic cells in a fashion that produces first a viscous solution, which then spontaneously cross-links or sets into a stiff gel with controlled permeability. And we can extrude these materials in any geometry we choose, spheres, strings, and rafts. They all have in common that the cells are largely immobilized. They cannot escape, which is important for stem cells. But the gel is semi-permeable and so allows indiffusion of oxygen, glucose, and of course out-diffusion of the therapeutic agent, insulin, and accompanied by C-peptide. At the same time, we keep the polymer loading low enough so that immune components don't see the polymer, but largely see what we call viscous water. And so these systems are not recognized as foreign body by the immune system. And that's key to their long-term survival. Different geometries, they all have in common a 200 micron standoff distance to the host, and we have evolved this technology from the left to the right, as I'll illustrate in a couple of slides. Proof of concept, the top row shows our rodent model work, and the bottom row focuses on human donor islets and stem cell-derived beta cells, ultimately the large-scale payload. On the top, you see that we've always worked with immunocompetent rodents, black 6 mice on the left. We've gone out to 300 days, correction of blood sugar, and most of you understand this model. STZ is used to make the mice diabetic. The blood sugar goes up. And within about a day of transplantation of encapsulated rat donor islets, at about 1,000 IEQ, so a marginal dose, blood sugar gets into the healthy range and stays controlled for the periods that you see. 300 days for mice. In Vista rats, these are outbred, demanding rats. We've gone out to about 180 days and counting. Human donor islets perform similarly. We've gone out to 50 days in STZ black 6 mice, and we have preliminary data from Yorkshire and not shown here, Göttingen mini pigs, where we see C-peptide, we see viable islets, and we've seen blood sugar correction in the STZ mini pigs as well. A few more visuals. We are transitioning to developing the raft processes. These are 3D bioprinted. You see that image on the left. We've gone up to 10-layer patches, which is perhaps a bit overkill. But on the right is a 3-layer cross-hatched triangular unit cell device that would contain islets or donor stem cell-derived beta cells in these 600 micron diameter string sections that are fused at the junctions due to the polymer chemistry that we impart to them. They have high surface area, they are getting vascularized after implantation, but because they are a large device, about half the size of a hand, they're similar to a hernia patch. They can be implanted into a defined spot, such as above the ratius muscle, and they can be explanted should that be necessary. So the secret sauce that we contribute is the polymer design that allows the extrusion, the cross-linking within the string and between strings at the junction points, all the while enabling function of the islets. All of these compositions, whether capsules or life rafts, have in common that we can exclude 150 kilodalton IgGs, and that's shown on the left image. The IgGs are labeled in red. They cannot penetrate into the gel string that shows up as black. The middle two panels show islets, donor islets encapsulated in strings, and in one layer of a 3-layer patch. You don't see the other layers. This is a confocal image. And on the right, we see development of vascularization after 2 weeks of explantation from a pig model. So these hydrogels support both in vitro and in vivo function of donor islets in these experiments. All of this is based on proper design of the polymer science that can form networks. We also can use processing technology to control the distribution of the polymers. And shown on the left-hand side are examples where we have a homogeneous distribution of cross-linked networks. We can impart gradient compositions so that there is an outer shell that is more efficient at excluding IgGs. And in the center, we show that we can photobleach a small cube right inside these gels, wait for an hour or longer, and we see no infill, no diffusion of any extractable polymers into that bleached area. And that's very important to show long-term persistence, low extractability. On the right hand, we show an example of how we compare the capsules pre-implant on top and post-explant after 6 weeks from a mouse model. The capsules have not increased in size, which is very important and somewhat unique to the field because it means that the porosity of the outer shell, the membrane that imparts the molecular weight exclusion, is not is not negatively affected. So these are still showing the same 150 kilodalton exclusion that we had pre-implant. The example on the right shows again donor islets, but we've also validated this technology with MSCs and with iPSCs, which we've implanted for 95 days. Some of these were modified with suicide genes to allow triggered ablation of the cells, which may be a good safety feature that the FDA is keen on, so we can stack both physical containment. These cells, even if they expand when we encapsulate undifferentiated iPSCs, they expand, but they cannot escape from the capsules with suicide technology where desired. In addition to delivering the cells into the patient, we have realized there is another delivery challenge, and that is from the cell producer to the hospital ultimately. Stem cell-derived beta cells, as well as human donor islets, don't do well in petri dishes and typically don't stay functional for more than a couple of days or a week. So we've developed an approach that's based on replicating the granular cellular environment of cells in vivo, but it's based on synthetic microgels shown in red in these images that surround green cells. And on the top left, you see an example of a vial filled with this jammed gel. It is stiff enough to be invertible without starting to run. These materials help us support cells during storage in 3 dimensions, similar to a parking garage for cars. And we have also learned to impart cryoprotective properties to these. We can cryoprotect individual cells and small clusters with as little as 1 and in some cases 0% dimethyl sulfoxide, DMSO, which has been around for 60 years but has problems in its applications. The mode of action is it dehydrates cells and, of course, prevents formation of ice crystals. This technology is also based on deep polymer science that we pioneered over the last 30 years. We can control the size. We have scaled up into overhead stir tank reactors. These are non-cell penetrating, so no worries about diffusion kinetics in and out of the cells. We can make them degradable, and they are applicable, not attachable, but applicable to many different cell types. Here is a quick video that shows how we can embed cells into these jammed gels. Upon freezing, the microgels minimize free interstitial volumes, they dehydrate the cells, protect them during cryostorage, and when they are thawed, the microgels can be removed by washing or degradation. We can make them biodegradable if they were to be implanted, and they are ready for use. So we believe that we are contributing at different points along the value chain from stem cell design, therapeutic cell design, all the way to the clinic. 2 more examples. On the left are donor islets and HIPSC clusters suspended in these fully transparent jammed gels, so perfectly suitable for confocal and other microscopy. On the right are cryo data where we have frozen to -80 ibex. These are brain endothelial cells and induced NK cells. And they come out of thawing. You will not be able to see this on the back at 99% viability above controls. And similarly for the iNKs, they come out with 85% viability above the 10% DMSO controls with commercial DMSO media of 70%. So very promising, and as I mentioned, this also so far works for small cell clusters, and we're pushing ahead into larger ones. So in conclusion, I hope I've been able to show you a bit about how we combine molecules with cells into therapeutic devices of different geometries. We're working on scale-up, on partnering on the cell side. We develop auxiliary technologies, and we have identified a clear path to the clinic for type 1 diabetes. I want to thank the organizers for inviting us all here or bringing us here to beautiful Rome at this time of the year, and some of our sponsors. We have obtained a 1 million Canadian JDRF support grant that we are very excited about, and other national and international funding organizations. Thank you very much, and I'm happy to take any questions probably afterwards because we are out of time. Thank you very much.